I'm Dr. Ateet Patel, an interventional and structural cardiologist with Hamilton Healthcare System. My wife is actually a nurse practitioner. We met in Chicago. We have an older son, and then we have twin boys who will soon be 2. Lots of Thomas the Train, and now we're sort of into youth soccer, so a gentle reminder every day of why we do what we do, and no matter what happens to me during the course of the day, their needs for their dad are unchanged, and so that's probably the thing that keeps you most human and grounded. So I grew up in a small town called DeLand, Florida. To be very honest, in high school I was just one of the playful kids. I played a lot of sports. I played golf, tennis, basketball. I was a reasonably good student. My parents would probably say not a great student. I ended up going to Emory for undergrad. For a while, thought I might go to law school. Thought I might work in finance. Decided that wasn't really for me. Changed courses and then actually took a year off after undergrad. Worked in Washington, D.C. at the National Institute of Health doing research in oncology. Great experience. Knew I didn't want to do basic science research or oncology, but still added a lot to my experience. But I think when you grow up with a lot of physicians in the family, you get to see them practicing from the time you're a child. Like I used to go to the hospital with my dad and hang out at the nursing station. And I think my dad always imparted on me, he's like, you get to do something very special. Not everybody gets to do what we get to do. And so to just try to remember that every day, even in the hard times, that we get to do something really extraordinary and be a part of people's lives in a way that other people just can't do. And so that's a privilege. I come from a family of physicians. My dad was a private practice internal medicine doc, and my dad's older brother is actually also a physician. My mom's uncle's a physician. There's a lot around, and so when you're around it that much, I ended up, I guess, in the family business. Went to UCSF in San Francisco for internal medicine residency for 3 years, and then went to Northwestern where I did my cardiology fellowship, and then came back to Emory for my third go-around to do training in interventional and structural. So I think Hamilton's in a really interesting place. They've always had a really good cardiology program, but they've really done a lot of new things in the last few years with opening cardiac surgery, adding a structural heart program, adding a lot of complex procedures, and I think, this is just the very beginning of that launch into a sort of a new era for the cardiology program, and so it was exciting to be part of that. And we don't always appreciate that healthcare in the Southeast is different than on the West Coast and the Midwest, and so I think I bring a unique perspective of a lot of different healthcare systems and ways of practice. In the complex healthcare system we live in today, I think always remembering the patient in front of you and asking yourself the question, if this person was in my family, how would I take care of them? What would I do? Knowing that we give people their quality of life and allowing them to get back to the things that make them human, whether it's their job, whether it's their family, whether it's their hobbies. A stop with us is really not the goal. It's to get back to the things that they want to do. So we're just a conduit to get them back to their lives.